According to the acting health minister, Limpopo is leading with registering people for the vaccine. We'll find out how the Limpopo Health MEC Dr. Phophi Ramathuba. Dr. Ramathuba, very good afternoon and thank you for speaking to us. Delighted at your success. Can you take us through how the vaccination registration program in Limpopo has been so successful?
Afternoon to all your viewers. The launching of the registration, the EVDSC by the minister, I think if I'm not mistaken, it was on the 16th of April. As a province, on the 21st of April, the Premier launched the assistive registration, wherein while people were encouraged to register on their own, because we are dealing with a rural province, most of the areas still have got challenges with network connectivity. We had to come up with innovative ways on how to assist our senior citizens in those rural areas. And especially that the category of people who were registering were the above 60 who, by their age and advanced age, it makes it difficult for them to be inclined with technology. That is why we had 3 stages of registration. The first one is self-registering, which anyone can do. The second one was the one that will assist you all our sites, 37 sites, including all our paid facilities. You could visit and you would be allowed and you would be assisted to register. The third and the most critical, which I felt is the one that is effective, was to release all our community healthcare workers, which are around 9,000 plus, to go to different households in the villages where they support with all the other work, wherein we have allocated them gadgets, the smartphone that is required, your Androids, wherein through that, and we loaded it with airtime. These were the cell phones that we should have used last year during the screening, household screening for COVID-19 at the beginning of the pandemic in the country. So what we did, because that time we had challenges with the system, those cell phones were not utilized. So this time around they came in handy. Our community healthcare workers are going door to door, assisting elderly people to register. Now your second question would be, what about those areas we are saying they've got challenge with network? We have got, of course, utilizing the manual or the paper work, which is, of course, an inconvenience, but that's the only way we could mitigate. When a community healthcare worker visits your household, they will take your information using a manual on that form. When they get to the clinic or their station, whether it's a hospital, they will be able to register you electronically or transfer the information. So that system, we've seen it working up to so far, and hence you see more people being registered, despite the fact that most of the people who were worried that like ours will not be able to achieve the required numbers to be registered.
Dr. Ramathuba, let's talk a little bit about the numbers. What numbers have you registered versus your target?
We have already surpassed, the last time I checked, we had already surpassed the 450,000, which is by now more than that. And we had thought by phase 2 we would register 500,000. And you know that phase 2, it still have a long way to go. So meaning by that time we would have registered quite a lot of those. And of course, depending on the availability of vaccine, because as we register, we are also at the same time vaccinating. And if you remember, as a province, from the beginning, we said it will be difficult for us to chase away or return back those who would visit our facility without being registered or without even an SMS because of our province, how it is. So what we were doing is that all the senior citizens that would come, whether you have registered or not, if you have not registered, we have got a help desk that will assist you with the registration and will therefore assist you. But of course, it's got its own pros and cons, challenges that you find the numbers being more than what we had planned for that vaccine station. But I must indicate to say there's no elderly person who has ever been returned in our facility because they came without an SMS. The only time wherein you might find that we could not vaccinate everyone is when the allocated dosages would have finished before we could finish everyone who presented themselves on that particular day. That is why we even had to change and say, instead of vaccinating from Monday to Friday, let's open all our 37 fixed vaccination sites and vaccinate from Monday to Thursday, because until such time when the supply for vaccine is stable and we'll be getting more vaccines that we are wearing, we will then be able to move even up weekends and vaccinate, because we are controlled by the availability of the vaccine.
What is the current availability of the vaccine in your province at the moment?
It will depend. Some weeks we will get 24,000 dosages delivered, which will not even last for 3 days. Some weeks we will get 59,000 dosages being delivered. Last week, I think Thursday, we received 37,000. So it will depend. But having discussed with the acting minister, she made a promise us that she will make an intervention, I think last week, Friday, which she has done. And we are expecting to receive more dosages, and we'll be able to continue with the vaccination. But I must indicate the challenges, it's known by everyone. It's not a challenge of South Africans only. It's a global challenge. The availability of vaccines, it's something that must appreciate our government, which is working very hard across the clock to make sure that we do have those dosages that are required to be delivered in our provinces.
Now, one of the smart moves, Dr. Ramathuba, that you've talked about was sending the 9,000 healthcare workers out to assist with that registration process. Are you having conversation with other provinces to share your successes?
I think we in our NHC meetings where we all present our plans, we have presented this plan from the beginning that when it was indicated that you need to register first before you get vaccinated. This is the strategy that we developed to say the only way we can access is to utilizing the community healthcare workers. One of the issues which makes us to utilize them is because, you know, when you say you want to register people in their own household, criminals and opportunist thugs start to use that opportunity and want to go and say, we're here to register you. And then at the end of the day, they smuggle you and do all sorts of bad things. But then with the community healthcare workers, the advantage is that these are the people who on a daily basis, even prior to the pandemic, these are the cadres that have been doing a lot of work when it comes to HIV and AIDS, screening for TB within our community. Recently, we had even trained them to start screening people for non-communicable disease. Some of them now have been trained to check for your blood pressure and your blood sugar. So they are familiar with those households. Already they know that in my ward, I've got so many senior citizens, because even with the screening last year, they've been able to do the work and pick up. If you go back to March last year in April, when we did the first screening, the mass household screening and testing for COVID-19, as Limpopo, you'll remember that we have the largest number of those that were screened, and many people were asking, how did you achieve the number? We still use the very same formula that we used that time. You use people who knows the system, people who understand the healthcare system. You don't invent new things when you already have systems that are working. You capitalize and build on them. One of the advantage of using them is that as we are now busy doing the outreach, going to villages to vaccinate, you know what they would do? They can visit a village and register 1,000 people. Now we will then, the following day, get our outreach team to go and vaccinate that a population, because there could be a lot of them. So the advantage is that because they know their own community and their constituents, they are able to even profile to say, in house number 5, you've got a 95-year-old, you've got a 106-year-old. So we do have what we call the VIP, the very important people in our community who do not have to go to the vaccine sites. We visit them and vaccinate them in their households because they are advanced age and they cannot move anymore. So that is one of the benefits of using the community healthcare workers to register. They know these people that we require or need to be vaccinated.
Limpopo Health MEC Dr. Phophi Ramathuba, thank you kindly for your time this afternoon.